I call the honourable member, Dr. Rajin Prasad. Namaste.
Namaste, Mr. Speaker, and thank you very much for the opportunity to take a call on what will be a very important bill, an important series of discussions in the Select Committee and indeed through the other stages of this bill. I accept what the Minister said about her sincerity in bringing this bill to the House, rising out of the concern for our most vulnerable children, and that this is not politics. I hope in return the Minister will also accept that this side of the House also is very sincere in trying to find solutions to long-standing problems around vulnerable children, and that the Select Committee will use all of its intelligence and all of the resources available to it to interrogate in depth what these proposals are about and whether or not they're likely to succeed or not. And I hope that we will not rush that process through, that we will have the information we require, and that the changes made to this bill will be as a consequence of the collaborative discussion. So, Minister, you have our assurances on that. It is often said, and worth repeating, that a nation's greatness is measured by how it treats its weakest members, and especially its vulnerable children are certainly its weakest members. And if we just use that quote as a standard, then our greatness is not particularly something to be particularly proud of in this particular area. And I guess we can all take responsibility for that. But it's worth reflecting, Mr. Speaker, as to how do we get this way? Because New Zealand has one of the oldest child welfare systems in the world. You know, when Minnie Dean was killing off children in Winton, the last person to be hung in New Zealand for murder, we immediately passed the Infant Life Protection Acts and then the Child Welfare Act, and that act stood until the 1970s. So we've had a long experience of protecting children, promoting them. So how is it that in the 21st century our performance is so bad? Why have we not been more successful in protecting our most vulnerable? It's not as if we have not had many policies. We've had policies for Africa. We've had new ideas for Africa. We've had new reports for Africa. We've had new programs being developed all the years that I've worked in this particular field, Mr. Speaker, and yet they end up in this place. And in reading this particular bill, I've been looking to see what is missing. And throughout the Select Committee process, I hope we as a committee will look at that. Because I don't think grand plans, Mr. Speaker, will achieve the goals that the Minister has set, and that we accept that our children should not be placed in a vulnerable position. There are a number of things missing. And I think, Mr. Speaker, and we should confront those. We should try to seek explanations about what is missing from the proposals so that we can make the proposals, Mr. Speaker, a more comprehensive one. And Jacinda, my colleague Jacinda Ardern referred to a number of these. The time has come for us to look sincerely at the needs of our children, particularly our most vulnerable, as comprehensively as possible from the perspective of what impacts on their development. And I think sometimes this House takes the idea that this is a comprehensive plan far too readily without actually interrogating what that means. And if we did, and we have the science, we have the knowledge, we have the research to do it, to understand it. There are textbooks and libraries full of that, full of this information, Mr. Speaker, about what provides the children the best start in life and what protects them from vulnerability. And yet, much of what we do in our society works against those interests. And Jacinda Ardern talked about poverty. And you cannot talk about addressing the needs of vulnerable children without addressing that as well. Poor housing, poor health, communities that are suboptimal. All of that. I don't know what the member is interjecting about, because if the member would like to listen and just carry on listening, we might get to the same. We're on the same Select Committee, Mr. Sabin, and I think unless unless we reach a level of understanding of these points, Mr. Sabin, we're going to make the same mistakes again. And I say to the member, please listen, because we are sincere about the Select Committee doing this work well. And that information is there. Maybe in that member's life experiences, he has not come across this material. Well, many of us have, and we intend to ask the officials to show us where those are. And unless those be addressed, I say to them, Mr. Speaker, this is the problem with the member, and if this is what carries on, then this is how the Select Committee will progress. Because here, the Minister has very sincerely put her agenda on the table, and we're responding to that sincerely. But, Minister, if that's the kind of response your colleagues will give us, then I think the member might need to speak to you to say how you intend this to progress, because we intend it to progress well. So the total environment, I said to Mr. Sabin, also needs examination. And unless we do that, we won't have it. We can all talk about those things inside the home that makes for a good place to develop children. But if the community in which they live is toxic, and if the policies that inform that are toxic, and if our whole perspective on what happens to that subset of society is toxic and negative, then nothing will happen. And Mr. Sabin, that's precisely the environment from which many of these vulnerable children come. And so I ask the member to just contemplate that. We are not here, Mr. Speaker, looking for short-term gains. We're not looking for something to suit our particular ideological agendas. We are looking for some real change. And members of the Select Committee ought to look at that in some detail. So I ask then, is the package that we see here likely to make a real difference? And have we examined, Mr. Speaker, the programs we have introduced over the years comprehensively enough to see what is it about them that we missed? Because there was a time that this Parliament debated proposals just like this and passed policies and laws that were designed to address it, and yet we come back and we have to redo them again. Mr. Speaker, we all know a lot about vulnerable children. Early identification is not the problem. In many, many environments, those children who are vulnerable are identified sometimes 1 week after they're born, sometimes 1 week after they enter early childhood education, sometimes 1 week after they enter primary school. And yet, though many of those children end up capitalizing on the negative side of the effects of that vulnerability. So a lot of professionals see this. Now, why is it then, Mr. Speaker, that even when we identify them, even when we refer them somewhere, those children, in many, many cases, end up by being vulnerable? Well, there is something missing in this. And the bit that's missing is who are the people actually working in these vulnerable environments? And how are they trained? What is their expertise? And because, Mr. Speaker, in order to do that, it actually requires a lot of expertise. And that's a piece that's missing out of the considerations here. The work, even after you identify vulnerable children, the work to get them to the point, Mr. Speaker, where they receive the services that they need, where they make the personal changes they need, where their families adjust as they need to, is a very, very expert set of activities. And yet, and the profession largely charged to do that is social work and the allied professions. But we do not have minimum standards for their training. We do not have compulsory registration for them. We don't have workforce planning and development. We don't know how many we need. The many, many courses around the country have got great standards and very poor standards. There are 2-year programs and 4-year programs. There are postgraduate programs and certificate programs. And yet somehow these professionals are entitled to enter into the lives of these vulnerable children and in the hope of making some difference. So writing a coordinated policy amongst government agencies is easy. Actually making sure that they are serviced by competent people who make a change is harder. And this will flounder again unless we have the right people working with that. And so mandatory registration of social workers is important so that we can guarantee to the vulnerable, those who will come to work with you will be competent, whether they're in the statutory agencies or the voluntary agencies. We want to say to social work educators, it's time they understood well what the what their profession, what is demanded of the profession, and they should be resourced and positioned to deliver to us the social workers we need. And the final point, Mr. Speaker, is that we need to know that we're producing sufficient numbers of them so that we have a workforce pipeline. In this area, for as long as I can remember, there's nothing there. The Social Workers Registration Board has come up with a very well-written report saying it's mandatory reporting should now be compulsory. And I think it's that missing link that I think has to be tied into this program, and we certainly will be asking officials to tell us what those figures are. Thank you, Mr. Speaker.
I call